ready to begin?
All systems go.
All systems are go.
It's now 1:08, and I'd like to call to order the Tuesday, May 19, 2020 regular meeting of the Board of Directors, the Oklahoma Tobacco Settlement Endowment Trust. In preparation of the meeting, all requirements of the Open Meeting Act have been met. I would like to remind everyone that even though this is a virtual meeting, we will observe the rules and decorum of a regular in-person meeting. I'd like to welcome everyone joining by Zoom or on the YouTube live stream. I'd like to announce that if the meeting is disconnected, the meeting will recess, reconnect, and reconvene. If connection cannot be restored after 1 hour, this regular meeting will be reconvened on Friday, May 22nd at 2:30 p.m. at the same physical location. Now, I'd also like to state there will be a period for public comment near the end of the meeting. If you're joining through your computer or Zoom, you can raise your virtual hand or state your request in the chat feature. If you happen to be joining by phone and would like to participate in the public comment, text your name and phone number to, and this is the number, 405-642-6860. Again, that public comment period will take place near the end of the meeting. I will recognize you when it's your turn to speak, and you will be unmuted. Your comments will be limited to 2 minutes and must pertain to items listed on the agenda. Finally, persons who disrupt the meeting with offensive or obscene comments or chat will be removed from the Zoom conference. Now I'd like to move on to item 2 of the agenda, approval of the minutes of the March 12th regular board meeting. I'd like to ask if the board members have reviewed the minutes from the March meeting.
Yes.
Yes.
Yes. Yes.
Is there a motion to approve?
So moved. Jack Allen, so moved.
Second, Casey Kilblain.
It's been moved and seconded to approve the minutes. Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
She's unmuted.
Yes. My click button doesn't work now for unmute, so I know that over
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Curtis Knoll,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, the motion passes. Item 3 on the agenda, Chair's Report. In this report, I have 2 topics I'd like to talk about, the TSET strategic plan and also the 2020 board retreat. On your screen has been flashed or put up the strategic plan that we approved at our last board retreat. And it's our policy at every board meeting to take a look at our cumulative accomplishments as it relates to our strategic plan. I'm sorry, my phone is thinking I'm giving it instructions. If you take a look at the strategic map, there's 3 areas of focus: focused investment, thought leader, and operations. And I'll have a few comments in each of those categories, starting with focused investment. In focused investment, we're trying to drive the focused investment. That sounded like
Needs to be muted.
We're gonna work on this technical difficulty. I'll talk to see if it's.
Yeah.
Is that better?
Yes.
Can the board members hear me? Thumbs up if you can. All right, very good. So picking back up with the strategic map, we have 3 areas that I've mentioned. First one is focused investment. And in that, driving behavioral change in tobacco use, nutrition, and secondary lifestyles was an important area of our work. We've had accomplishments in that area. We see increased investment in promoting programs that help Oklahomans live healthier lives. Registrations to the Oklahoma Tobacco Helpline has been shown to increase. Shape Your Future has provided toolkits and helpful tips to media, teachers, and content has run widely across the state. These meetings mark the end of an exhaustive process of revamping TSET's Healthy Living program, and it's been creating a hotspot approach. In terms of prioritizing programs that target youth, in this meeting, you will see a recommendation of a vendor to fund a youth educated action, and the campaign should start early this coming fall. On impact of high-risk underserved populations, in May, the Oklahoma Tobacco Helpline launched a specific program for callers with behavioral health disorders. And this is important for coordinating high-risk patients at risk for COVID-19. Drive policy change. We provided information on mission-specific bills at the Capitol on topics ranging from prevention funding, farmers markets, Tobacco 21 state laws, and supporting the existing tobacco-free policies. And then in terms of investment in high priority research, OTRC's Michael Busanel was recently awarded a National Cancer Institute grant to use mobile phone technology that can help cancer patients determine if they're at risk for having COVID-19. Now in the second category, that's thought leadership. And under using appropriate media strategies to build awareness of TSET programs, TSET Communications and Health Communications used agencies' expertise to expand and promote the reach of COVID-19 information and resources. Resources from Shape Your Future, Tobacco Stops With Me, and the Oklahoma Tobacco Helpline were used to promote positive health behaviors that reduce factors. These are risk factors for COVID-19 complications. Under number 3, operations, aligning board of directors and board of investor activity. We've had continued conversations with the board of investors to increase coordination and collaboration between the 2 different boards of directors that are involved with the activities of TSET. And then in reviewing future funding strategies, we're using a multiple year snapshot of available earnings and estimated earnings to inform budget planning after wide fluctuations in market and earning estimates. A lot of this related to COVID-19. So that's a review of accomplishments since our last board meeting related to the strategic plan. The second item is the 2020 board retreat. The board retreat will be held August 27th and 28th. We're currently scheduled to hold the retreat at the Chickasaw Retreat and Conference Center. We will continue to monitor guidance about meetings and evaluate accordingly in terms of how that meeting will be run. The fourth item on our agenda is the Executive Director's Report, and the Chair would like to recognize Julie Bisbee.
Thank you. Thank you. Well, under operations, that is 4A, we are now having some staff return to the TSET office. We are returning in staggered schedule, but you can see by the work in this agenda that our staff has been working remotely and been quite diligent about hitting deadlines and continuing to serve the public. We are a paperless office, and so this was a fairly seamless process for us, but we continue to look for process improvements as the work from home continues somewhat. Also, we have been interviewing candidates virtually for some open positions, and those interviews hope to wrap up. So we will be adding a program officer and also health communication manager as approved by this board. A quick overview of executive director activities. Typically, this would be where we would highlight a lot of the speeches that we might be doing or education efforts across the state. But as you might imagine, as the state has taken precautions for COVID-19, our in-person outreach has been somewhat limited. We have continued though with columns, press releases, and have even cut short videos that can be used in online classes or for other groups to explain some of the things that TSET does. So we continue to look for ways to innovate as the environment changes. And also a quick legislative update. Senate Joint Resolution 27 is now a state question. I'd like to recognize our Director of Public Information and Outreach, Thomas Larson, to give an update on that.
So Senate Joint Resolution 27, it passed the House last Thursday and the Senate on Friday. Because it's a joint resolution, it does not need to go to the governor for signature or veto. It goes to the Secretary of State's office, and there will be a state question probably in November that will ask voters to change the apportionment of future master settlement agreement deposits to Oklahoma. Currently, the TSET endowment receives 75% of each year's payment, and the legislature receives 25%. The state question would flip those percentages so that the TSET endowment would receive 25% and the legislature would receive the other 75%, minus a small percentage going to the Attorney General's office. The legislature's portion would be used to draw down federal Medicaid dollars. For TSET, that's the most significant piece of legislation that came out of the session. There were a few other bills of note for us. Senate Bill 1423 by Senator McCourtney. That was the straight up T21 bill. It changes Oklahoma statute to be in line with federal statute, raising the age to purchase tobacco products to 21. That will help the ABLE Commission with their enforcement here on the state level. That passed the House and Senate last week and was sent on to the governor. There was also Senate Bill 1785, which creates the Oklahoma Farmers Market and Farmers Hub Act. And that puts in statute a number of the rules and regulations that the Department of Agriculture had around farmers markets and promoting farmers markets in Oklahoma. Because of the shortened or truncated legislative session, because of the pandemic, one of the bright spots might be a number of bills that did not make it out of the legislature. You know, we were tracking a number of bills that changed some tobacco definitions and were possibly problematic in making room for new products that were coming on the market to get around being labeled as tobacco products or to avoid taxation. All of those bills that changed tobacco definitions died in the legislature. Another bill that would have reintroduced smoking to Oklahoma prisons also died in the legislature. That's a recap of where the legislative session ended. I should say the legislature can still come back until May 29th. They passed a resolution, and that will essentially automatically adjourn the session sine die on May 29th. But if they choose to, if they decide to come override a governor veto or decide they want to pass more legislation, they do still have the option of coming back into the Capitol and doing that up until 5 p.m. on May 29th.
Great. Thank you. And
This is Curtis Nelson. Was there any discussion, any further discussion on comprehensive tobacco legislation?
during after probably about March, when the smoke-free bill did not move forward, there was not additional conversation after lawmakers returned. Are there any other questions about items covered in the executive director's report?
All right, thank you. Item 6 in the agenda is discussion and possible action on funding for food access partnerships. And again, I would like to recognize Julie Bisbee for an explanation.
Sure, and just a point of clarification, this is item 5 for those following at home or for our board secretary. What we have seen as the world has changed dramatically over the past 9 to 10 weeks is that COVID-19 has dramatically disrupted our economy and made very apparent the need to support access to food and how food plays into our healthier lives. So what we are proposing to the board today is a new short-term funding opportunity that would allocate up to $1 million in funds to expand partnerships that increase access to fresh and nutritious foods over the next fiscal year. Programs would be taken through the program committee and review, and that would be a competitive process that we would hope to roll out here in the next few months and be making awards for the next fiscal year. Early research shows that people with health conditions such as high blood pressure, diabetes, heart disease experience more complications from the COVID virus. We know that 1 in 6 and 1 in 4 children in Oklahoma suffer from food insecurity, and early data shows that that number is likely to have increased dramatically with the recent economic downturn. So we put forth this category for the board's consideration.
Thank you, Julie. Discussion from board members.
So
Julie,
this wouldn't, go ahead.
So Julie, are you
Go ahead, Marshall.
yes?
Jack, did you have a question?
Yeah, so this would not take effect until 2021?
We would start developing a competitive process upon approval of this, and we would hope to be able to move that timeline very expeditiously, but likely a new contract would not start until July 1.
July 1 of this year?
Correct.
Okay. I was going to say, if you're going to wait another year, the whole landscape might have changed by then.
Thank you for that clarification. Curtis, did you have a question?
Yeah, could you give an example of what kind of ready-to-go projects you're referring to?
Sure. So I know that at the local level, we've had grantees work with farmers markets to do things like the double up food bucks, where your dollar goes further if you're buying fresh fruits and vegetables. I know that there are projects currently seeking federal funds that may need a state match for something like that. There are also farmers market enhancements that are being proposed as people are wanting to continue to safe social distance. That might include a website of what may be available at the farmers market and perhaps a facilitating curbside pickup. There's also discussion about working with large grocery chains to figure out ways that those double up bucks might be, or some similar incentive item might be something that can be put into more wider range use. So it would really, we would work through the programs committee to come up with some of those deliverables through an RFP and then bring it back with recommendations to the committee with the final choices.
Thank you.
So are you looking at the retreat in August, being able to look at some of these and I mean, can we move that fast?
Yes, we would like to fast track this process.
Mhm.
And so it is possible that if we get a process up and running and get good applicants, that we could even perhaps do it before August, but it all kind of depends on a lot of factors falling into place, but that would be our goal, is to move quickly.
To be able to move forward before the board met, would the program committee have the authority, if we granted that today, that upon approval from that, I mean, it's just going to be easier to get just a committee together than it would be to get the whole board. If we have to do if we're approving the amount now.
Correct. It is my understanding, based on guidance from our legal counsel, that the program committee could meet, or they could meet virtually and make those decisions. That would be a public meeting, but we have the ability to do that.
I just hate us to wait until August to have to be able to do it. I mean, because the issues are arising and are here now. I mean, it's, you know, and going back into school and all of that. So I think whatever we would need to do, that if we get something identified and able to help, that we should do it sooner rather than later.
Agreed. Marshall, did you have a comment?
No, I just, you didn't make it clear to me anyway that you were recommending this, or you were just wanting to discuss this.
Staff has met and discussed this with the programs committee, and this is a recommendation that I am making for this to consider. A new.
Okay. Thank you. Do we need a motion to approve this?
Yes,
I so move.
that's Marshall.
This Curtis, second.
It's been moved and seconded to support this motion. Any further discussion? Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes, sorry.
Jack Allen,
Yes.
Casey Kilby,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
The motion passes. All right, thank you, Julie. Item 6 on the agenda, program committee report. The chair recognizes Dr. Curtis Knowles.
All right, thank you. The first item on program committee report today is the update on the OSU Medical Authority residency training program. And if the board recalls, we had approved an extension to monies that were already earmarked for residency program at OSU, and asked OSU to bring a proposal back. They had it set up and they've been having more issues with healthcare system in the area, trying to get slots. The hospital system itself wanted to basically take over the program and just have them be kind of a silent partner, is my understanding. And they wanted more control of it to make it an OSU residency program, not a hospital-based residency program. And so they come back with another proposal and basically ask for $4.7 million, which is more than twice the remaining dollars that they have that we approved for availability. And this would start in July of 2022, and they're asking for an early commitment based on recruitment and getting everything set up. It's a total of $157,682 per resident, and a total of 30 residents at full capacity. So 10 residents per year, split over multiple programs. And if you go to, it starts on page 20. When we get into the new proposal, I got to find it here. It'd be programs at the Jane Phillips Medical Center in Bartlesville and Great Plains Federally Qualified Health Center in Cherokee until full capacity. And they're needing a commitment, but the ask to the program committee seemed a bit excessive in that we would be funding all but, a couple percent of the entire cost. So we asked them to give us a better idea of what kind of additional funding they could bring to the table in the way of a match. And I think what they're asking of us is to have some kind of MOU saying we're willing to move forward if we can come to that number on what they need. Jonas, if you're on, could you give us an update and tell us if they've brought back any idea about what additional funding they might be able to leverage?
I can give you an update while Jonas makes his way into the room. Awesome. Okay. This is our Director of Programs, Jonas Mata. And if you'd like to answer the question, thank you.
I talked to Dr. Pettit and basically said that 4.7 million was more than at this point we might be able to afford given the cuts we're taking, and actually asked him to consider the remaining 2.39 million that we committed to them through FY21 as a possibility and to come back to us with a proposal for that amount. And I asked him to submit a proposal for our consideration so that we have something for the August meeting.
So
Okay.
just clear, this is an update. We don't need to take action today, but it is an update of where things stand since this has been roughly a year since we had a previous MOU with OSU.
And he has till July 1 to get you that updated proposal?
I give him until about July 1 to 15. We need it in time to take a look at it and then put it together for the board.
Yeah, I think this just highlights the complexities of starting a program of this nature, and getting 30 additional residents out there is a great idea and really supports our efforts to put physicians into rural communities. So I think the project's worthwhile. I think the ask of $4.7 million was just more than we're able to do at this time. So I think as we get more information, we'll bring stuff out of committee back to the board. But I think for now, we're just waiting on additional information from them.
Yeah, I agree. I think the program committee very much is in favor of trying to do this. It's just at what level can we support it?
Mm-hmm.
Yeah, and we were pretty direct with them during the meeting about kind of, that we wanted to do something like this, but it has to be realistic in what we can fund. Okay, so moving on, discussion of the COVID-19 impact on the fiscal year 2020 grant performance. Clearly everything's had an impact. COVID's had an impact on all of our programs and ability to get employees together and to do things. And there's a few examples in the board packet, but delays have reduced performance in the completion of activities and research, earmarked for completion in the fiscal year 2020, resulting in a lapse in the fiscal year 2020 dollars. And a few examples of, just kind of so you understand, the purchase of the BioFire light scanner machine allows scientists to detect mutations in DNA, which helps for testing in coronavirus. allowed for kind of things we're supporting, allowed for 96 samples to be run at a time, and increasing our testing capabilities for COVID in the state. We've also had money used for increased branding, and so that we can get word out about kind of COVID-19, the educational message, along with our other programs. So it also highlights our funding of the 211 system, because 211 become kind of the go-to point for contact for COVID resources. I myself handed that number out many times, like, hey, if you really are concerned, you want to be tested, you want to know what resources are available, get information, call 211. And so I think 211 may become a more popular number because of all this. All right, item C. So discussion possible action on Healthy Living Program 2.0 grant awards. So there were 53 applications eligible for review, which closed on February 28th of this year. Of the 53 proposals, more than half sought to serve at least one priority county, which is one of our priority statements. And they were given funding preference by scoring. Proposals were vetted by 21 external reviewers across the country. At the end of all this, 35 applications met the requirements of the RFP and are being recommended to the board for funding. And these 35 applications serve 37 counties across Oklahoma. The applications are listed in your packet, proposed to serve 20 priority counties for an amount not to exceed $6.944 million and for year one. And then years 2 through 5, the first year of funding is slightly below the program maximum. However, years 2 through 5, 35 grantees could be up to $9.38 million if all grantees budget the maximum amount allowable. So that goes up some. And because we're on video call, we have to read each of these.
Oh, man.
Yeah, there's a lot of lists that I'll be reading from today so that people on audio only can hear these. So Atoka County Health Department serving Atoka for $105,000. Bryan County Health Department in Bryan County for $128,000. Canadian County Health Department in Canadian County for $183,340. Cherokee County Health Services Council in Cherokee County for $220,000. Cherokee Nation in Adair County, $220,000. Comanche County Memorial Hospital in Comanche County, $220,000. Gateway to Prevention and Recovery in Pottawatomie County for $220,000. Grand Nation in Craig County for $220,000. Great Plains Youth and Family Services in Caddo and Kiowa counties, $151,631. Cowboys Community Action Foundation in Haskell County, $141,000. Kingfisher County Health Department for Blaine and Kingfisher counties, $175,000. LaFleur County Youth Services in LaFleur County, $173,697. Lincoln County Health Department in Lincoln County, $192,096. Marshall County Health Department, Marshall County, $110,000. Mays County Hope in Mays County, $205,462. McLean Garvin County Youth and Family Services Center Incorporated, Frontline Family Solutions in Garvin County, $183,000. McKernan County Health Department in McKernan County, $204,000. Muskogee County Health Department in Muskogee County, $219,946. Norman Regional Health System in McLean County, $179,000. Norman Regional Health System in Cleveland County, $220,000. Norman Regional Health System in Grady County, $220,000. Nowata County, $119,000. Oklahoma City County Health Department, Oklahoma County, $360,000. Oklahoma State University in K County, $182,000. Oklahoma State University in Creek County, $220,000. Oklahoma State University, Payne County, $220,000. People Incorporated, Sequoia County, $168,273. Pittsburgh County Health Department, Pittsburgh County, $204,519. Pontotoc County Health Department, Pontotoc County, $220,000. Pushmataha County Health Department and Pushmataha County, $120,000. ROC MND Area Youth Services in Delaware County, $220,000. Rogers County Voluntary for Youth, Rogers County, $220,000. Rural Health Projects Incorporated in Garfield County, $220,000. Tulsa County Health Department in Tulsa County, $360,000. Wichita Mountains Prevention Network in Carter County, $220,000 for a total of $6,944,964. Total of 20 counties served. Did I miss any?
That was very good. I'm very proud of you.
My eyes are starting to cross fall on the lines.
Very good, Curtis. This recommendation came from committee and does not require a second. Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
All right. Item D is discussion of possible action on no cost extension for the 2020 agreement for Ocasker. And due to the implications of COVID-19, TSET funded researchers from the OMRF, OU, and OSU had to suspend their bench science programs. And then a lot of the purchasing processes have been delayed over the last, now it's 8 or 9 weeks, impeding progress on research grants. You just can't receive or send items, and people can't come in and work in their labs. These suspensions result in unexpected delays in spending for many of the research grants. And with a staggered return to research activities as reopening occurs, OMRF has identified approximately $500,000 in fiscal year 2020 funds that could remain unused when the fiscal year ends after June 30th of 2020. Because of this, OMRF trying to get ahead of it, and TSET staff recommended a 6-month no-cost extension to OMRF for their fiscal year 2020 Ocasker agreement. If approved, it would not add any additional funds. It merely extends the end date of this current contract from June 30th, 2020 to December 31st of 2020. No other terms or conditions of OMRF's Ocasker agreement with TSET would change as a result of this extension. In your packet, you'll see a request and letter from the Ocasker Scientific Director, Dr. Courtney Griffin, for your review. And
So Curtis, how would that impact the current year or the FY21 request for 2.91 million? How would that interface with that? I realize it's two separate things, but you got the same people working. So
yeah,
I don't understand.
I think because a lot of it's equipment and stuff, that is a great question. I don't think we considered if it would decrease the amount, because like you said, you can't go back and pay salary if you're not doing it. I understand the equipment purchases. So Julie, are you able to speak to that?
Yeah, so Director of Grants Management, Tessa North, can address that, but it is my understanding that a lot of the funds are used for research equipment. Tessa can provide more clarification on that.
That's right. So these awards from Casker, sorry, I have a faulty mask.
one of the main things that OCASCR does with TSET funds is they issue their own research grants. And so they've issued research grants that have been awarded, but those grantees have not been able to conduct research over the last several months. So the work that would be continued from FY20 into 21 is from individual researchers that are awarded from OCASCR, not from the staff per se that work on the grant under us.
So these are for the current fiscal year and for the extension that's being discussed, these are for grants that have already been let. So the funds have been allocated to groups that successfully applied. They just have not had the time to spend the funds. And I think all of you can attest to the slowdown that has happened with COVID, and this bench science is no different.
Yeah, I understand that. I just want to make sure we're not double counting.
Yeah,
Sure.
I think it would give new grants moving forward while continuing the grants that have already been awarded. So they would just continue their process as normal and bring in additional researchers on top of the ones that we've already funded.
So will then and we're saying it's 500,000 that's rolling forward. Is that then going to be added in to the FY21 budget? I mean, if we're going to allow them to spend it, then we've got to account for it and be able to check it. And in my mind, if you don't add it in there, then we're actually docking them.
Yeah, it should be carried forward into our 2021 budget.
Mm-hmm.
I'm not sure that's right. Julie?
Just a carryover.
Mm-hmm.
Because we don't account by calendar year, we count by program year, which is confusing. That's why there's such a large payable on our books at the end of the year for that current year's program. A lot of program expenses don't get paid till after the end of the fiscal year. This wouldn't be any different, I wouldn't think.
Okay.
Is Jennifer on the call?
Correct. So the expenditures, since we will have a contract with them that is an extension for this current fiscal year, those expenditures will roll out between now and December. So they will be part of FY fiscal year. However, those funds are allocated and available, and then they will also have a contract for the current fiscal year for 2 more grant cycles of regranting.
So I'm not sure that answered the question. So should we add that 500,000 to the current year budget, or to the proposed 21 budget?
Marshall, you were correct. We will not close out FY20 until these invoices have been paid.
That's what I thought. Yeah.
Okay.
About
6 months after the close of the year.
Okay.
So this proposal just leaves the current grant year open for them.
For OCASCR.
For OCASCR to end on December 31st with whatever they've submitted at that point.
Okay.
Correct.
It doesn't change the accounting, it just changes the legal documents.
Okay. Do we have to vote on that?
Yes. This recommendation came out of committee. A second is not required. Any further discussion? Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right. Item E is discussion on possible action fiscal year 2021 contract and grant renewal request. This is a 1-year funding fiscal year 2020 only for each of these. And as with other items, I have to read a detailed list here. Not quite as long, thankfully. So renewal request, Change Lab Solutions, technical assistance training and product development, $250,000. Emory University, the Public Health Academy of Oklahoma, $172,589. the Oklahoma Department of Mental Health and Substance Abuse Services Wellness Enhancement System Initiative, $584,788. The Oklahoma Healthcare Authority Sooner Quit, $270,231. Oklahoma Healthcare Authority Health Communications Cost Share for the Sooner Quit program, $2 million. Oklahoma Hospital Association Hospitals Helping Patients Quit and Work Healthy Hospitals programs, $593,126. Oklahoma Medical Research Foundation, Oklahoma Center for Adult Stem Cell Research, $2,910,000. Oklahoma State Department of Health Center for Chronic Disease Prevention and Health Promotion, Technical Assistance, Coordination, and Training, $1,140,103. On-site partners, technical assistance, training, and product development, $95,000. Physician Manpower Training Commission, Oklahoma Medical Loan Repayment Program, $416,230. Rescue Free the Night Smoke-Free Bars and Clubs Program, $213,750. University of Oklahoma Health Sciences Center, College of Public Health Program Evaluation, $1,585,000. University of Oklahoma Health Sciences Center, Stevenson Cancer Center, Oklahoma Health Promotion Research Center, formerly the Oklahoma Tobacco Research Center, $3,686,000. University of Oklahoma Health Sciences Center, Stevenson's Cancer Center, TSET Cancer Research Program, $5,335,000. University of Oklahoma Health Sciences Center, Stevenson's Cancer Center, Helpline Management Subcontract with Optum, $4 million. University of Oklahoma Health Sciences Center, Stevenson's Cancer Center, Helpline Oversight, $287,451. VI Marketing and Branding, the Tobacco Stops With Me, Shape Your Future, Oklahoma Tobacco Helpline campaigns, $11,685,000. VI Marketing and Branding, state match for federal funds to Oklahoma Healthcare Authority, $2 million. Total requested is $37,224,268.
All right.
Question.
Any questions?
I do. Most of them have decreased or remained the same, but you've got a couple that have increased. Item C, if we could just kind of explain why it increased in it, and in J, K, and then I'm assuming R is the youth campaign for VI.
All right. So you may have to run through those again, but I've got it in front of me as well. So
Okay.
Item C is the Department of Mental Health and Substance Abuse Services. We did increase their budget. They are going to be doing more of the nicotine replacement therapy program for consumers that come into their inpatient facilities. We found that that has been really helpful in gaining referrals, but also research shows that people who quit tobacco when they are quitting other substances are more successful. What was the other?
Then down to J, who are on-site partners.
On-site partners, Jonas Mata, Director of Programs, really took a lot of care with that, and he can explain that.
On-site partners is Heather Wooten and two associates. Heather used to work for Change Lab Solutions, and she is a great thought partner for us and provides technical assistance around healthy food access as well as active living. And so we're going to use her. She's already been developing some webinars for us for HLP 2.0, and we'll continue some of that work and actually get involved in the training come July 1st. And what we did there is that we decreased the Change Lab Solution amount, and so added some of that to her expertise because our grantees like her, and so do staff. She does great work.
Okay, and then R with VI.
Yes, so you'll see an increase in the budget for FY21 for VI marketing and branding. That does include increases that were approved by this board last board meeting when evaluations for 2 campaigns showed that a decrease in investment was also associated in a decrease in effectiveness. And a portion of that will help to fund the youth education and prevention program as well.
So that was my question. That does include what we're looking at for the youth.
Correct.
Okay. Thank you.
Thank you.
Any further discussion? The recommendation came out of committee. It does not require a second. In the absence of further discussion, roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, the motion passes. Thank you, Curtis. We're now ready to move on to item 7 of the agenda, which is Public Information and Outreach Committee Report. The chair recognizes Casey Kilblain.
Thank you. As you peruse through your packet, you see lots of the information that we have there. Just a few highlights to touch on. I believe last meeting we talked about our Tobacco Stops With Me. The Big Tobacco Targets campaign had received a gold award at our Oklahoma market in our Addy Awards, and got to move on into the district, and we received a bronze award there for the 10th district, which is really very exciting. That's covers states Arkansas, Louisiana, and Texas, and it really is a strong competition. So hats off to you, Sana, your group, and everybody. It was really that's exciting for us to expand beyond Oklahoma and have some district recognition. The communications, they continue to support the partnerships, especially with the Wichita affiliated tribes and building healthy military communities. That's at no cost to TSET, and they're allowing us to put our branding information everywhere and really be a part of that. In addition to that, they've partnered again with OSU and OU, branding some activity booklets that are being promoted across all 3 partners. So those should be coming out. I'm anxious to see those always. Then we started a new partnership, and I don't know if any of you have been able to go on to the Shape Your Future Facebook page or website and check out that with Scissor, it's a Shape Your Future healthy meal planning, and they're kicking it off with the Oklahoma City Farmers Market down in Scissortail Park. I glanced at it last night, and it was really kind of fun to watch the cooking show. They didn't get to do it out in the park this time, which I guess the kickoff sauna was last weekend was the first one. And so they actually cooked there in Jones Assembly and did the cooking show with that chef, and that was fun. But the whole concept is they'll be in the park, they'll do a cooking demonstration, and all the farmers market will be there. You should be able to buy the products and everything right there at the market, and then they're going to help you learn how to cook it healthy. So I'll just drive an hour and a half to the farmers market, but okay, we're in a food desert down here, but that's all right. Yeah, we got beef. We have beef. Okay. Moving on, Tobacco Helpline is going to launch a new we did launch it in April. They're beginning to test some new animated Shape Your Future commercials, and going to a focus group to see how those are coming out, so that we're able to ramp up and begin some new ads there for Tobacco Stops With Me. Also, the Shape Your Future cross-sectional survey is going out into the field, and they're going to really start testing that for us to see where we are with that. FAO, the OK in the Know, that has been able to really be helpful for lots of people, particularly with the Healthy Living 2.0. Grantees are going in there for training and different things there, as well as on the public side. A lot of COVID information has been made available, and we actually are seeing a lot more people pop up and utilize that. So the communications group has been busy, although from far away, but it doesn't seem like they've missed a beat on anything, and it is nice. And yes, our little Davis News has had articles from Shape Your Future lately, so I was very pleased to see those. But that kind of takes care of our communications. And again, I would encourage you, if you haven't gone on to the Shape Your Future Facebook page, that's where I could find it the easiest, was that video. I do kind of think it's fun, but I'm weird. We watch Food Network on Saturday mornings too. So, you know, I just thought it was really fun that we could say it. And the guy was really good to say it was a Shape Your Future program, you know, and TSET was on there, a little small, but it did get said, and we did see it. But I thought that was kind of cool. That's it for communications. We don't need to ask you for anything else just yet, but in item B, we had discussed and had approved to move forward in our youth, combating youth and smoking and vaping and all of that. So we put together the RFP, and it has been let, and I'm going to let Julie kind of walk you through that and tell you those responses and what our recommendation coming out of the PIO committee for that process.
Great, thank you. Yeah, so following the retreat and the adoption of the strategic plan, where this board made a priority work in youth prevention and education around tobacco and obesity, on April 13th, TSET released an RFP seeking bidders for a youth media and marketing program. The purpose was to seek offers from qualified entities for the licensing of professionally created, evaluated, and evidence-based media messaging that could be implemented in Oklahoma. This campaign would work to decrease tobacco use, decrease initiation of tobacco use, promote quitting of tobacco or nicotine, and promote the physical activity and better nutrition to reduce and prevent obesity among Oklahoma youth. The request for proposals closed on May 13th. TSET had 4 applications from vendors within and beyond Oklahoma. After review of each proposal was conducted by 2 external reviewers and 2 internal reviewers, TSET recommends to the board of directors awarding the contract for this RFP to Rescue Agency. In their response, Rescue was able to clearly and thoroughly demonstrate experience and success in these types of campaigns in other states. They were also able to demonstrate that they would have content that could be licensed and ready to go in Oklahoma, hopefully by late summer. TSET staff recommend to the TSET board of directors the approval of an agreement in the amount of $1.5 million for fiscal year 21, renewable for up to 4 additional years, based on funds available and contractor performance. Are there questions?
This did come out of committee.
This was presented to the committee.
All right.
Mm-hmm.
In the absence of any further discussion, and since this came out of committee, the second is not required. Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Casey Kilbane,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
Julie, if we can add one more thing on that, after in our committee meeting when we were talking about it, after we heard all the information about it, I think the exciting part is that the person from Tulsa that actually will be rescue staff that knows Oklahoma is here, and they're just real. It was Ken and Curtis would probably remember when we started Free the Night, the woman who came initially to present it and actually ran the program there for as it was kicking off so successfully. She will be the person in charge of this whole new youth effort for us. So I think I was very pleased with that.
Right, yes, they will have local staff here, and they will coordinate with VI marketing and branding for paid advertising placements, as well as developing that campaign. But Rescue has a track record nationwide of understanding youth subgroups, that kids from urban areas might have different things important to them than kids from rural areas, and the subgroups beneath that. And so they have been effective at reaching those audiences well.
And this has been part of a discussion about them moving into more youth out of kind of the bar stuff anyway. So I think it's a good move.
Yeah, very good. Okay. Okay, moving on to item C, under our PIO committee, we had our outreach activities. Again, Julie kind of talked about it, and Bruce in their comments at the first of the meeting. We've been relevant with COVID as much as we can on our social channels, and being able to create some materials that we can hand out that has that information with all of it in there. Julie has done a couple of podcasts that have been aired, both on March 6th and the 21st, or the 15th, I'm sorry. So that's fun. Journal record, we had a column in that. We've had TV appearances. So as much as we possibly could do before we all got shut down, I thought that we were really making some good progress. And actually, Julie's still been out there even under COVID. So TSET is launching its survey this month in the newsletter, so we can kind of check in on the newsletter and see what needs to be tweaked on that. There's a sampling of media clips in your packet. Moving into sponsors and training, those were in your packet as well. The category's closed. We've committed and have sponsored 34,000 of the allocated 35 this year, so we were right on target with that. Again, item E is our upcoming events. There's a list of those, some that have been canceled and some that haven't. So I think the ones that are not canceled thus far are still there. So take a look always. If there's something that would be interesting for, or you would like to be a part of, contact the office in that. And the last thing is that we're getting ready to launch the Healthy Living 2.0. They have their grantee orientation on September 2nd. So that will be a very nice way to kick off the fiscal year, and actually hopefully getting back into the fall and maybe new similar school activities. But that concludes our report for PIO.
Thank you, Casey. That brings us to item 8 on our agenda. It's the agency's operation committee report. The chair recognizes Marshall Snipes.
Thank you, Mr. Chairman. If you'll all look at page 46 in your packet, you will see what we're calling an earnings estimate. This document was prepared by the State Treasurer's Office to give us some kind of a feel for the impact of the downturn in the economy related to the virus and the impact on the stock market and our other investments. And as you can see in the highlighted line in orange down there, 2/3 of the way down, we're far short of where we were last year. And if you look at where we ended up last year, clearly we're not going to be anywhere close to having the kind of certified earnings that we're used to the last few years. So as that's a backdrop as we go through this budget process, for you to understand that caused us to pause. At that point in time, we had no idea we still don't really have any idea how this is all going to sort out. So we erred on the side of caution as to not get carried away with some extra money in the budget. And as you'll see shortly, we're budgeting essentially most of the budgets, what you just heard earlier from Curtis, and I want to thank him for reading all that so I didn't have to. But the issue is, and we'll vet this much more thoroughly at our retreat, but the issue is how much money are we comfortable with? Does the 3-year moving average still work? And some of those kind of issues that we'll talk about later. But the point is, we were cautious as a result of this information in terms of our discussion in the operations committee about the budget for next year. So that brings me to, well, first, let me pause there. Any questions about that? Okay, if not, we'll move on. Our budget to actual this year for both operating and for programs are essentially on track to where we normally were at that point in time. And as you can see, that's about a 64% spend rate in operating and a 54% spend rate in programs. Both of those two items will probably come in under budget when all is said and done. And then if you'll recall from our last board meeting, we had a lot of discussion about the balance sheet. And since we didn't get periodic balance sheets, we made a request to the staff that they provide us with balance sheets every quarter going forward. And you'll see that in your packet. I believe it's page 49. And the most important thing for you to look at on this balance sheet is the equity line of $1,209,000,000, and compare that to the cumulative master settlement agreement payments of $1,073,000. And the difference in those two numbers is what we have to spend. That is what for the future includes what's been certified to spend and any unrealized gains moving forward. And there's still some discussion going on about how to break those two items out. But you can see clearly we've got about $135 million. And so that made us feel pretty good about continuing with a standstill budget, a slight decrease. But caution again, because our certified earnings that we will get in September for FY22 will be lower than what we're used to. So we're going to start seeing that information every quarter. And I think thanks to Jennifer for putting that together, it wasn't necessarily easy for her to have to do that. So any questions on the balance?
Yeah, Marshall. So we generated this, and how is the treasurer's office feeling about that?
I don't have any idea. They gave most of this information came from the treasurer's office.
Right. Okay.
Yes.
So I would assume they'd feel be okay with it. I mean, the value of the fund at the top, the 1.225 billion, came from the treasurer's office.
Okay.
We have worked with the treasurer's office, and we will continue to work with them. Obviously, this information changes quarter to quarter, and so we will have that update. And I know Jennifer has worked with the staff accountant over there who has quite a bit of experience on the TSET fund. So we continue to have open lines of communication and information sharing.
Yeah, there's been good communication between the two staffs, Casey. Okay, but I don't think we have achieved our goal from last August of having a real good relationship with them in terms of them understanding our short-term and long-term needs. They're still investing for the long term. And
okay. So now that the three numbers at the bottom, the cumulative certified, the reserve fund balance, and the cumulative cash withdrawals, that number, the first one represents all 100% of the payments to Oklahoma?
Correct, over time.
So that's what is split between us and the legislature.
So you're looking at cumulative certified earnings?
Yes.
That is the amount of money that the fund has provided to the board of directors for expenditure.
Yeah, that doesn't, that's just for information only. That doesn't really impact the balance sheet in terms of the reason we wanted the balance sheet was so that we could make sure that with the deterioration in our investment portfolio, that it didn't deteriorate to a point that we had less money in our investment account than we had been given in the master settlement agreement. So there's some confusion about that we're going to get into in August about what would happen if our current fund balance dipped below the amount of money that the tobacco companies have paid us, so that we literally were dipping into principal. And it's not clear to me if that's allowable or not. There's some conflicting language in all the the legal documents that caused me to pause. So the good news is we've got $135 million as of March 31st after the initial hit on the stock market in order to operate into the future. And that's clearly enough money, absent some additional catastrophic stock market results, for us to continue on a budget that's being presented here today. And so I think the Operations Committee was comfortable that we could continue to, at least for this year. Then in our retreat, we can revisit the 3-year rolling average and all those issues at that time. So for today, the purpose was just to make sure that the budget that we're proposing for next year that we have plenty of money to be able to do that. So that was the purpose of the balance sheet. Okay. Thank you. Well, let's move on to the final item, which is the approval of the budget. And Curtis went through he went through all the budget issues for the programs. So I don't think we need to rehash that. The detail is in your packet in terms of how that works into the spreadsheets that for our budget purposes. But so I'm not going to go through and read all of that to you unless, Julie, you want to highlight any of it, or do we need to talk about any of these items separate from what we've already discussed?
If you'd like, I can give the overview, or you can cover that, what has changed.
Go ahead.
Okay. In our operations budget, we were looking across where we could postpone expenditures or reduce expenditures. And as you may recall, we have 2 budgets. We have a programs budget and an operational budget. In the operational budget, we decreased travel. Currently, there is an executive order that bans most out-of-state travel for state employees. There is very limited in-state travel currently with COVID-19 precautions. We also will, if earnings do not meet expectations, it is the policy on salary increases that they do not move forward. So we did not budget for any additional performance-based increases for staff. And so we also had a decrease in some of just the administrative things. As you may recall, our administrative budget is quite small compared to the programs budget. The programs budget, in line with the strategic goals that this board set in the 2020 retreat, we had level funding for the Oklahoma Tobacco Helpline Services, Youth Education Media Campaign, the Physician Manpower Training Commission received their request. We have the new category that you approved with the Enhancing Food System and the incentive grants. And you discussed the increase in the Department of Mental Health and Substance Abuse Services NRT program. Also, health communications increase was carried over for this year. And then we saw reductions in the Hospital Association. Our Healthy Living program is targeted, and so we have fewer grants than we had in previous years under this new model. Breathe the Night took a small decrease. You will also note a decrease in the helpline oversight budget, a decrease in conference sponsorships, and a decrease in our funding of research grants. In addition, there were new programs that were anticipated to launch with the HLP 2.0 and reallocating some of those funds. You have seen decreases in those new proposed programs that would go through a competitive RFP process.
Thank you. That concludes the Operations Committee report.
Thank you, Marshall. The Agency Operation Committee recommends approval of the proposed FY 2021 budget. Coming out of the committee, second is not required. Any further discussion? Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Jack Allen,
Yes.
Casey Kilbane,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
All right, thank you. Now that brings us to item 9 in the agenda, that's new business. Any matter not known about or which could not have been reasonably foreseen prior to the time of posting the agenda. Is there any new business? No new business. Item 10 on the agenda is public comment, and public comment will be limited to items listed on the agenda. We are now preparing for public comment of the meeting. We have compiled we are in the process of compiling a request to speak. This is the final opportunity to request the opportunity to address the board on items contained in today's agenda. We'll pause for a few seconds.
Bruce, you might read the number, or I can, if you're joining by phone and would like to make a public comment, text your name and your phone number to 405-642-6860. 405-642-6860. And we have one person who has raised their hand, Vicky Wagner. Vicky, you are unmuted and have 2 minutes to make your comments. Oh, I'm not sure, she's still muted. Okay, Vicky, go ahead. Okay, Vicky, did you have any comments?
Maybe she could text again, or
She raised her virtual hand in the waiting room. Okay, Vicky, if you don't have comments, we will mute you now. The hand is down, and that's all. I have no other requests for public comment.
All right, with no other requests for public comment, brings us to item 11, which is adjournment. Chair is looking for a motion to adjourn.
Jack Allen, so move.
Curtis Knowles, second.
Been moved and seconded.
Nope, before you vote, so someone actually sent me a full comment on text.
Too late.
On behalf of the National Health System, thank you for entrusting our organization to continue the HLP 2.0 work in Cleveland, McLean, and Grady counties. I don't have a name, but that came from a phone number via text.
Right.
Thank you very much for that comment. Now we have a motion on the floor to adjourn, and it's been seconded. Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yeah.
Jack Allen,
Yes.
Casey Kilbane,
Yes.
Curtis Knowles,
Yes.
Ken Rowe,
Yes.
Marshall Sykes.
Yes.
The meeting is adjourned.
Woohoo!
See you, kids.
Yes.